cancer is one of the most common diseases that plagues women all around the world, but it's also one of the most misunderstood. So today, Dr. Sheila Wijayasinghe is going to be clearing up the facts around breast cancer and talking to us about how we can make sure our breast health is in check. So Dr. Sheila, thank you so much for joining us here today.
Thank you for having me.
Now, many of us know what breast cancer is, and there's a lot of awareness that has been generated about breast cancer, and there's a month dedicated to generating awareness.
Absolutely.
But can you tell us a little bit about how common breast cancer really is?
Breast cancer is the most commonly diagnosed cancer in women, and it is the second leading cause of cancer-related deaths. Approximately in any given year, we estimate about 23,000 women are diagnosed with breast cancer.
Wow.
And 5,000 of those women will actually die from breast cancer as well.
Oh, wow.
So it's quite common, and it has a significant impact upon women's well-being and their families' well-being, and that's why there's so much attention given to it. So anytime we talk about breast health, the most important pieces to talk about first are risk factors, and then certainly after that we talk about screening.
Right.
So the risk factors, like any other disease that we have, there are those that we can have control over, so we call those modifiable risk factors, and those that we have no control over. So specifically we look at things like the ones that we can't change. So those things we can't change are things like that we're women.
Right.
So that's one. Right. Our age. So that's one risk factor. As we get older, our risk of breast cancer does increase as well. Other risk factors that we can't control for our family history, and that's a really big risk factor that we always go through. So if you have a family member who's had breast cancer, especially a first-degree relative, so a sister or a mom,
right,
that increases your risk factors significantly as well. And then we look at the things that we can change. So there's a lot of great things that we can look at and we have control over that will make a big difference in your health. So specifically we look at weight.
Okay.
So higher weight is can increase your risk of breast cancer as well.
Wow, okay.
Because there's higher levels of estrogen in the body circulating and putting women at risk. So related to that, if you're physically active, it actually decreases your risk of breast cancer.
Okay.
If you smoke, it's best to try to stop smoking, because smoking itself is an independent risk factor as well. And things like alcohol and other lifestyle factors can also play a role. And one of the other ones that we also look at is breastfeeding.
Okay.
So in women who are breastfed for at least 6 months, we know that that actually protects their breasts as well.
Is there anything that we can do at home to see if there's been any changes in the breast area, or if we're developing any sort of symptoms around breast cancer?
Absolutely. So I think the best thing is to be breast aware. It's interesting, in the medical field we actually don't recommend self-breast exams because women tend to find things that may actually be benign, but I actually always think that it's best to know your own breasts.
Right.
But in reality, what we're looking for with a breast exam, or when you're looking at your own breasts, is to look for any changes in the skin. So if you notice any dimpling of the skin, or the skin becomes contracted or a little bit tighter in an area, if the skin becomes red in an area, that's not normal. And if you notice any bumps or lumps that are different for you, so naturally breasts are made of fatty tissue, and so they will be a little bit lumpy in everybody. But if you notice that your lumps are changing, which they do as we get older, but if they're harder in nature, or they're growing in size, or there's any bumps in the armpit area at all, those are all reasons to get checked out. And the other thing to look at is if you have any other symptoms, like you're not feeling well in general, or there's weight loss, or taking into consideration that if you have a higher risk of breast cancer, being breast aware really is important.
For more of our show, catch us on ANOKHImedia.com and our YouTube channel, and be sure to interact with us on Facebook and Twitter.